right, good morning. I'm Dr. Deuk, and we are at the Deuk Spine Institute, Surgery Center Vieira. We're broadcasting live surgery. Today we're going to start our first case performing Deuk laser disc repair, which is endoscopic transforaminal surgery at L4-5 on the left side. This is the patient's left side. This patient has a herniated disc at L4-5 and pain down the left leg. Are you okay? I put some numbing medicine in, and we're going to give it a chance to work for just a moment. The first step of these surgeries, this is the Deuk laser disc repair, is to access the herniated disc through the foramen using a needle. And that's the beginning. We do a discogram, and then we are going to place a guide wire, take the needle out, and use a dilator to access the disc herniation. And we're literally going to go right through the disc herniation and push it back into the disc and remove it. And then we're going to debride the annular tear so the disc will heal properly. And that's done with a laser. All right. Everyone agree? L4-5? Yes, left approach. That's what we're doing. We're at the left side, so we're ready to go. Let me know if it hurts. Just say ouch, okay? All right. All right, shot. Let's see where we are. I think you're, that's pretty good actually. I think if you could get us in a little closer at 4-5 once I get closer, but you can zoom in a little, that would be perfect. I'll give you some more numbing medicine. So this patient has a herniated disc at L4-5. That's just numbing medicine going in. She has a low pain tolerance. Not the lowest I've ever seen, but somewhat low. All right, there we go. That looks pretty good as far as the trajectory goes. L5-S1 you can see has a listhesis. We're not treating that level. That doesn't have an issue. Shot. So the first thing I like to do is encounter the facet joint. Lay still. Shot. The facet joint is just in the back of the spine and shot in the back of the disc itself. The facet joint is pretty much where the needle tip is. Jordan, why don't you show our audience where the facet joint is? So there's two types of joints in the spine. The facet joint, which is where the white arrow is, right there, and then show them the disc joint. The disc is much bigger, and the disc joint has most of the weight of the spine, about 80% goes through the disc, 20% through the facet. All right, and you can all see the tip of the needle there at the facet. Shot. So now my job is to navigate past the facet, and we want to enter the foramen. Shot. Shot. This takes a little jockeying of the needle. Can you bring the collimator down a little on the back? I think my hands are getting radiated pretty bad. There you go. Right there's good. All right. And are you okay? Shot. Are you all right? All right. Shot. AP. So you can see the needle is coming around those bony elements in the back there. I want to check AP view, anterior posterior, which is a front back. It's a different plane. And we use fluoroscope to navigate. Looks perfect. You know, right at the disc. So we're right at the medial border of the pedicle, which is where the disc is, normally. You can actually feel the herniation where I'm at right now. Are you okay? Mm-hmm. Now she's a thin lady, so perfect. You can see it's around a 45-degree angle to the needle. Were you having much back pain, or was it all left leg, or is it a combination of both? Huh? What percent was Both. What percent is back pain? What percent is leg? Oh, she's talking right now.
Yeah, so she said, I think you said 50-50, right?
50-50. All right. So what happened? 70-30. 70 is back, 30 leg?
Yeah.
All right. So she has a tear in the back of the disc on the left side called an annular tear. And the jelly from the center of the disc is pushed through the tear and is now outside and hitting on the nerves, which come down and go down her leg like this. And that herniation is hitting on the nerve, but it's also wedged in the tear. And it's the part that's wedged in the tear that causes the back pain. And it's the part that's sticking out that causes her leg pain, which we also know as sciatica. And it's also called radiculopathy. It's complicated. I don't want to go into those details, but anyway, are you comfy? Sciatica is really just pain shooting down the leg in the distribution of a nerve root like L5 or S1. And radiculopathy implies other things like weakness, numbness, paresthesias. You comfy? All right, good. How bad is that on a scale of 1 to 10? How high did it go?
9, 10, what was it?
How high did it go? Just 7. All right. Is that where you typically get your pain? So we tested her disc with a discogram. She took a full load of dye and went in like it was nothing, meaning that she has a huge tear and the dye just leaked right out of the tear through from the center of the disc out through the tear. There was no pressure there. I couldn't even get any pressure. So all she was a 7. I think if that tear wasn't as big as it is, she would have had a 10 out of 10 pain. But the dye just literally leaked out, so there was no pressure buildup. Typically you get the higher levels with a little bit of pressure buildup. But you can see the dye leaked out. Show the audience with that arrow where all the dye is in the epidural space. It leaked out the back of the disc, and now it's around the dura there. Yeah, yeah. And that'll all be absorbed. It'll go away. The body absorbs it. All right, so we're going to continue on. She had a concordant 7/10 at 4/5. So now I've got the guide wire. We're going to make our incision. She okay? We're making our incision right where we numbed up earlier. So this is a 7 millimeter incision. The entire surgery is done with a 7 millimeter incision. That's why people don't need to go to the hospital for this surgery. How's her blood pressure?
116/78.
That's not bad. We have our first drop of blood. Usually we get less than 20 drops of blood, less than a cc for the surgery. It's really pretty much bloodless surgery. Shot? All right. So because I have a guide wire guiding me, I can actually bring the dilator down. And you can see the herniation. Show them the herniation, by the way. Take a look at the herniation. It's right where the wire enters the back of the disc. Yes, there it is. It's bulging there backwards. You see that? That's it. Thank you. So this procedure should eliminate her pain from the disc, specifically the L4-5 disc. And it should eliminate the sciatica. That's what I'm expecting. I can feel the herniation. Literally bulging out right there. And I'm pushing it back inside through the tear. And we're going to go collect it. How you doing, doctor? She doing all right? All right. We're going to... Well, shot, shot. Well. Shot. Well, I can tell you there's a lot of inflammation, and that's going to determine how much pain there is, right? So the more annular inflammation there is, the more painful the surgery is. Shot. And we're bringing the tube down, and we're going to do the entire surgery through a 7mm tube. That's the outer diameter. Shot. That's why the incision has to be 7mm, because the outside of the tube diameter is 7mm. All right, we're in. Taking the dilator out. All right, so that's where we are. Good. We're plenty inside the disc. We don't even need to be quite that far, so I'm going to pull it back a little bit once I get the fluid adapter on. Any questions from our audience? Feel free to ask me questions during the surgery. That's why we're here and broadcasting live, so everybody out there can ask questions. The whole premise of our surgeries is to show you the world, what we do in the operating room. If we have difficulties, you're going to see those difficulties. If we have complications, you're going to see those complications. So we want there to be truth. And, you know, there's a lot of mysticism and myth and misinformation about spine surgery. And we want the public to know the truth, because doctors will only tell you what they want you to know. And a lot of times they lie, or they don't understand the condition themselves, and so they can't possibly explain it to you, the patient, even though they're treating it. Unfortunately, it's a situation where it's, you know, the spine world, spine care for neck and back pain is a world where it's acceptable to not know what's going on and still treat patients. And to me, that doesn't make any sense. So I think doctors have a responsibility, whether it's a physical therapist, a chiropractor, a surgeon. They should be able to figure out what's going on with their patients and provide them the right treatment, the best treatment available. So that's why we do the broadcast, is so you guys can all learn about the most advanced treatments in the world for treating back and neck pain. There's a piece of herniation right there. Okay, so I'm going to go grab it out. And again, herniations, if you've watched my broadcast, there are always multiple herniations. There's not one single herniation. I mean, sometimes you get a big one, but it's like fishing. You know, when you go out and you fish, you're going to capture different kinds of fish. Some are small, some are big, but they're all fish. So some of the herniations are small, some are big. Sometimes you get a whole school of herniations. You'll get 20 of them in a disc. Sometimes you just get one or two big ones. So it's really just, you never know what you're going to get. The MRI doesn't tell you. But I can tell you it's usually a repetitive, stepwise condition where you keep damaging the disc. There's the big tear right there, by the way, huge tear. And I'm going to start removing some of this nucleus. This is all part of the herniation. All right, any questions from our audience?
No, sir.
Let's go ahead and show why. Here's another herniation. Why does a herniated disc cause back pain? Let's show an animation.
Traumatic injury to the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain. The inflamed annular tear generates pain signals. Additional injuries can cause symptoms to worsen. Inflammation from the annular tear can spread to nearby nerve roots, causing leg pain. signals travel up nerves to the brain, causing localized back pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
All right, welcome back. Hope you enjoyed the animation explaining how the disc herniation happens and why it causes pain. So you can see from the animation that the cause of back pain and really neck pain if it's in the neck, cervical spine, or thoracic pain if it's in the thoracic spine is inflammation from the herniation. There's another piece of herniation. So it's inflammation within the annular tear that happens in the back of the disc called the posterior annular tear. And that inflammation basically is perceived by the brain as painful. Just like inflammation throughout your body can be very painful. Whether it's inflammation of your stomach lining, we call that gastritis. Whoever's had a stomach ache, you know, from a virus or from food poisoning, you understand what gastritis is, or a colitis, which is inflammation of your intestine. Very painful, miserable condition. Or proctitis, prostatitis. There's so many itises. Arthritis is one of them where the inflammation affects joints. So inflammation in the body can be extremely painful if it's in the right place. And the back of the disc is the right place for causing horrible pain. One thing it's important to understand is that virtually all of these patients that have bad discs in their lower back and pain from them, they have other causes of pain as well. Like the facet joints are the most common additional cause of pain, but there are other causes of pain as well, like the sacroiliac joints, which are like a facet joint. It's huge. It's where the sacrum or tailbone connects to the pelvic bones, so transmits all the weight from your spine down to your hips and legs. There's also pain from muscles like the piriformis muscle in your buttock. So many of these patients end up having more than one condition. It starts with a herniated disc and back pain from the herniated disc, and then it unfortunately, because of the way they walk and move and bend and twist, by favoring one side or the other, they end up injuring other parts of their back. So it's important that people understand if you have just a disc problem, we can fix it with this surgery, but if you have more than a disc problem, then we have to do additional treatments. About 20% of our patients need additional treatments after their surgery, and that's because they have other problems. These are all pieces of herniated disc, by the way. You can see the reherniation here. What's that? Everything okay? Yes. All right, we're just about done. Probably 5 minutes left, guys. Any questions from our audience? Why don't you, if there's no questions, go ahead and run the animation on how the laser surgery, the Deuk laser disc repair works.
We actually have a question from Richard from Facebook.
Sure.
I have a herniated disc through my C3 through C6. My doctor is saying I don't need surgery. However, the pain is unbearable.
Then you do need surgery. Yeah, so if you've got herniated discs in your neck, your doctor is telling you don't need surgery because they don't know how to fix your pain. That's the only reason they're telling you. They don't understand how surgery works to fix pain. But surgery can be used, if used properly, it can actually cure that pain. So you do need surgery. I disagree with your surgeon. The surgeon you're talking to has been trained to understand that disc surgery or surgery on the neck is only for arm pain or spinal cord damage. But that's the way I was trained too, but it's the wrong training. It's the wrong way. It's the old way of thinking about it, and it's wrong. If you have pain in your neck from the herniated disc, then you need surgery on the herniated disc to fix the pain. But not all surgeons are going to recommend that because they don't understand the source of pain. Let's go ahead and run the video.
The inflamed annular tear causes back pain. Inflammation of the nerve roots causes leg pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
Welcome back. I don't know if I fully answered the question of our viewer, but they were talking about how they have herniated discs in their neck and their surgeon told them they don't need surgery. But if you want to live in pain the rest of your life, then you don't need surgery. You're right. But if you want to get rid of your pain, you will need surgery. And my recommendation for you is the Deuk laser disc repair. That's the surgery I would recommend. The other option would be a fusion of those painful discs. So really what you need to do is figure out which of those discs are actually painful, because MRIs won't tell you which discs are painful. They'll only tell you which discs are herniated, and even then the radiologists miss the herniations 50% of the time. So you really need a good read of your MRI and grabber. And then you need a good surgery. So you need the right diagnosis and you need the right treatment. Not surprising, and that's hard to get. That's why we offer free diagnostic services as the free MRI review. You're welcome to submit your MRI and we'll look at it and make some recommendations for you based on your exam with us, which we do over Zoom. Of course, everything has to be verified when you come down here to Florida for your surgery. We want to make sure we've made the right diagnosis. It's very hard to make a complete diagnosis over the internet, over telemedicine, which is becoming more and more popular these days. So whatever diagnoses we make through telemedicine, we always want to verify that when people come down here and get their surgery during their office visit.
We have a question from Judith from LinkedIn.
Sure.
Who else does this in the U.S.? Who else performs this surgery in the U.S.? And are there other doctors being trained to do this?
Yeah, so there are no other doctors that perform the Deuk laser disc repair that I'm aware of. I would like to think that they would have trained with me. I've offered for doctors to come and train. We're open for training. We are a training facility. We have a fellowship, and we offer a 1-year training. But most surgeons don't want to take a year from their life, from their work and family, and come here to Florida to train. They just don't. They really, most doctors, unfortunately, aren't willing to invest the time and effort to learn some new technology. They're perfectly happy doing fusions, and we know fusions are bad. I used to do a lot of fusions because that's all we had before this technology came along. You're kidding me. This piece of herniation is not going to leave me alone. It's just going to block my view. So the answer is I don't know of anybody else that does it. There are endoscopic surgeons, but they don't do what we do here at Deuk Spine. And their results are not as good as ours. So if you want the best, you have to come here to Florida for it. We've been doing it 16 years now, arthroscopic transforaminal surgery that is designed to get rid of back pain and leg pain. Now, there are other surgeons that do endoscopic surgery like this, but they don't use the laser, and they just remove the herniation that's hitting the nerve going down the leg. So it helps with leg pain, but it doesn't do anything for back pain. And the reason is they don't do what's called an annular debridement. The annular debridement is what I'm doing right now with the laser. It can only be done with the laser. So the annular debridement requires a laser, and I'm cleaning up the tear so that it will heal properly. And what I'm cleaning is I'm getting rid of the scar tissue here and the calcium deposits, the bone deposits, and I'm getting rid of the nuclear material that's attached to the tear that's preventing it from healing and causing all the inflammation and pain. So this process you're watching right now, nobody else does it because we pioneered it right here at Deuk Spine. And this is what gets rid of the back pain from the disc. See the pink stuff? That's all inflammation. So this herniation has caused severe inflammation in this area for the patient. That's why they're having so much back pain here. And that inflammation spreads onto the nerve root because the nerve root is right here next to the herniation and the tear. And it actually gets on the nerve root and causes leg pain. So now I'm hoping this heals up nicely and this patient has great results with the surgery. That's what I would expect. Great questions from our audience, by the way. We're just about done. Just a few more minutes. I want to get the rest of the herniation here. And then we're going to move on to our second surgery of the day, which is rhizotomy, endoscopic. That's where we go in and basically deaden the pain nerves that cause pain from the facet joints. Okay? It's a different kind of procedure, but it's done also endoscopically. And we're going to go in and denervate the facet joints that are causing pain. Not in this patient, but in another patient. So that patient will be next. What you're seeing at 12 o'clock is the epidural space. That's where the traversing root is. Good. Just about done. I'm hoping this is it. I mean, all this stuff here looks old, so I think I'm past all the fresh herniation, and I'm just cleaning all this out. And I really hope this patient takes our restrictions seriously. And so at 12 o'clock is the epidural space. Over here, the nerve root will be in the neuroforamen, and you can see the herniation's gone. I do want to look laterally and get rid of this stuff, because this is also herniation. But this is in the side of the disc, not right by the, it's not perimedium, this is lateral. This is in the foramen. So this would be any kind of foraminal herniation that the patient would have. You get it by going backwards here. And it's just about being complete and thorough. You don't want to leave any herniation here. You know, for the first few surgeries of these I did 16 years ago, I didn't know about going lateral. And fortunately, the patients did fine. But over time, I started to see these things, these herniations out here. And I realized we need to get this stuff too. Otherwise, we're not treating the whole herniation. All right, it's looking pretty good. I think 2 minutes. Doctor? I've gotten all the acute. You can see the fibers of the posterior longitudinal ligament right there. So there's really no more herniation here. We're through the annulus backwards in the back of the disc. We're through it. It's just gone. It's been devastated by the trauma. But this will heal really nicely now that the herniation is taken out. And I've debrided the annular tear. So you can see the end plate right there, that's bone. The end plate on the other side right there. And you can see how the annulus is just gone. It's been destroyed. So my job is to debride it so that it will re-heal. And it will heal. Her body will heal this. as long as she doesn't re-injure it first. She really needs to take it easy. No bending at the waist for probably 3 months. And no carrying anything over 25 pounds. I hope she does what she's supposed to do. All right, we're done. Looks good.
Lights on, please. She did really well.
Yeah, thank you. Any more questions from our audience?
No, sir.
Scopes off, scopes off. Guys, got to turn the scope off when we come out, okay? Otherwise, you'll burn the light. No, we're just using a little antiseptic here. It's traditional in surgery. You always use a topical antiseptic. Give me another one. And that antiseptic we use is betadine, developed by NASA to fight germs. Commonly used. We used to use bacitracin, 50,000 units per liter. But, and that was like the gold standard in our irrigation at the end. But unfortunately, they stopped making it. All right, I'm going to show you the whole surgery was done through this tube right here. Can you all see this?
Yes, sir.
And we did it using this. This is the endoscopic rig. We've got a camera, light source, the endoscope, and a working channel right here that I do everything through. Irrigation, which I can control. I can turn it on, turn it off. I could squirt Luis with it. And now we're going to take the tube out. And you'll see, you know, there's just a small incision. I'm going to put pressure in case there's any venous bleeding. So we lose around a milliliter of blood. It's about 20 drops. So really 20 drops of blood is nothing. You could stub your toe. You can get a nosebleed, which is vastly more bleeding than 20 drops of blood. 20 drops of blood is literally nothing. Your body, it's 1 milliliter. Your body has 4,000 to 5,000 milliliters of blood. So you need to lose 20% of your blood volume to start having the cardiovascular effects of blood loss. Typically, as long as your starting hematocrit is normal. But 20% of your blood volume would be basically about 1,000 milliliters or a liter of blood. So you've got about 4 to 5 liters of blood in your body. You lose 1 liter, then you're going to start having some cardiovascular instability. Your heart rate goes up, your blood pressure may come down. You become hyperdynamic to compensate. My point is that we're so far below the blood loss threshold with this surgery because it's minimally invasive that we've never had to transfuse anybody. I've done 1,400 plus of these surgeries now, and we've never had a transfusion. We've never had a complication from the surgery itself. There's your incision, by the way. So it's a Band-Aid incision. You can see how small that is?
Yes, sir.
All right. Any other questions?
Yes, we have one for Nita from Facebook. She's wondering, I've had surgery in the past and pain is still there. Can laser surgery still be done?
Yes, laser surgery can still be done. If you've had surgery before, then and you're having pain, there's something causing your pain. And no matter what that something is, we can figure out what it is at Deuk Spine. And 99% of the time, we can fix it. Okay, so there are some rare cases which, you know, somebody might have their whole spine fused in bad alignment, and I can't fix that. Or the surgeon before destroyed all their muscle, killed it all. It's all scar tissue now. And that's what's causing their pain. I can't fix that. So there's a couple of things I can't fix, but the vast majority, 99% of people still suffering with pain after back surgery or neck surgery, we can fix. We just need to get to the source of the pain. To do that, I need an MRI. Sometimes I need a CAT scan of the spine, and I need a a video visit, like a video conference visit, where I can see where the pain is and ask questions, okay? And have you push on your body. We do that for free. Go ahead and put the link up for the Deuk Spine Free MRI review. But again, the most important thing is to understand where the pain's coming from. And your surgeons are just not figuring it out, but we can figure it out at Deuk Spine. All right, type up your questions and I'll be right back with you. We're going to show you a short comparison video of the Deuk laser disc repair, what you just watched, versus traditional surgery to fix back pain, which is a spinal fusion.
Or less invasive Deuk laser disc repair. This MRI represents a typical case with L4-5 and L5-S1 symptomatic discs. A symptomatic disc causing neck or back pain can include bulging discs, herniated discs, ruptured discs, degenerative discs, protruding discs, spinal stenosis, radiculopathy, and sciatica. This patient can choose traditional fusion surgery or the Deuk laser disc repair to help alleviate the pain caused by and within the symptomatic discs. Here, two patients with comparable disc injuries are treated. On the left, the highly invasive spinal fusion, and on the right, the least invasive Deuk laser disc repair. The spinal fusion requires a very large incision, usually leaving a large scar. The Deuk laser disc repair requires only a very small incision, usually less than a half an inch long. In this small opening, a cylindrical rod, called a dilator, is inserted to gently spread the muscle to create a small passage and guide through which the surgery is performed endoscopically. The incision for the fusion continues, including penetrating the skin, fat tissue, and multiple layers of muscle through to the bone. With the Deuk laser disc repair, a mallet is used to advance the tip of the dilator into the symptomatic disc. A tube, called the tubular retractor, slides over the dilator and is carefully positioned into the disc, again using the mallet. The rest of the entire Deuk laser disc repair surgery will occur inside this narrow tube. To access the spine, the spinal fusion requires the muscle to be separated from the vertebrae. This very invasive action causes trauma and permanent damage to the muscles. Whereas in the endoscopic Deuk laser disc repair, the muscle is not damaged. The endoscope camera is inserted into the tubular retractor to allow the surgeon to guide the laser inside each symptomatic disc. To accommodate the fusion hardware, a large bone grabber is used to perform a laminectomy by removing bone from the spine. The fiber optic laser used in the Deuk laser disc repair is manipulated with great accuracy to remove only painful inflammatory tissue from the disc. In this highly magnified view, the laser is used to precisely remove damaged disc material that is causing the pain. The laser is debriding, or essentially vaporizing, damaged tissue in the disc's outer layer, or annulus, specifically at the annular tear, the source of the rupture or herniation and pain. After the fusion patient's damaged discs are removed, a metal or plastic cage housing bone grafting material is inserted in place of the removed discs. Once the laser has removed the painful part of the annular tear, the endoscope and tubular retractor are removed, leaving less than 1/2 inch incision in the skin, which is closed with a single stitch, Steri-strips, and a Band-Aid. Total time for the Deuk laser disc repair surgery, approximately 1 hour. The fusion, however, is still underway. Holes in the spine must be tapped in preparation for the large pedicle screws that anchor the fusion hardware. The Deuk laser disc repair patient is in recovery usually 45 to 60 minutes before released to go home. The fusion screws are inserted into the bone, as shown in the X-ray. After all screws are in place, rods are used to connect the screws together to prevent movement of the secured vertebrae. Cross-links are added to bridge the rods together for additional stability. Fusion hardware, by design, is to fuse joints that normally move, preventing natural movement in the damaged portion of the spine. Whereas with the Deuk laser disc repair, there is no loss of movement. Normal movement and flexibility of the disc and joints is preserved. The Deuk laser disc repair patient is soon back home, enjoying life, with a very fast recovery, allowing normal activities without pain. Meanwhile, bone graft material is placed throughout the fusion surgery site. These morselized pieces of bone will eventually grow together to help promote the fusion process. Prior to closing the wound, a temporary drain is installed to allow excess fluid to drain. Average surgery time of a traditional 2-level fusion is 2.5 hours, with an additional 3 to 4 hours in the recovery room. As we've seen, in comparison, a spinal fusion requires a much larger incision and results in a significant amount of scar tissue. The Deuk laser disc repair's half-inch incision leaves no scar tissue around the spine or nerves. A large amount of bone is removed with a spinal fusion. With the Deuk laser disc repair, no bone is removed. Each disc is accessed through a natural opening in the spine. The entire disc is completely removed in a spinal fusion, even though only 5% may be damaged. The Deuk laser disc repair leaves the normal parts of the disc in place and removes only the painful annular tear on the damaged disc. Fusion requires hardware, including screws, rods, plates, etc. The Deuk laser disc repair does not require any hardware. The patient is totally hardware-free. Fusion surgery is very invasive. Cutting and moving the muscle structures and tissues for a spinal fusion causes trauma, resulting in permanent damage to the muscles. Whereas with the Deuk laser disc repair, there is no damage to the muscles. The Deuk laser disc repair is the least invasive surgery available to repair a damaged disc. With spinal fusions, patients are required to take highly addictive narcotic painkillers, which can cause constipation, bowel, and bladder complications. Due to the minimal pain, narcotics are not needed with the Deuk laser disc repair. Spinal fusions have a high risk for infection. The Deuk laser disc repair has a very low risk for infection. In the 7 years the Deuk laser disc repair has been performed, there have been no infections. Spinal fusion surgery has a very long recovery and requires a great deal of physical therapy and time to heal from the trauma in the muscles and the spine itself. Whereas the recovery from Deuk laser disc repair is in a matter of hours or days, rather than weeks or months. With fusion, the spine is being fused together, losing movement. Whereas there is no fusion with the Deuk laser disc repair. Normal movements of the joints in the spine is preserved. Spinal fusion results in loss of mobility. There is no mobility loss with the Deuk laser disc repair. In fact, most Deuk laser disc repair patients experience improved mobility after the surgery. The Deuk laser disc repair is FDA approved. All the instruments and equipment used are FDA approved. This proprietary surgery itself has been peer-reviewed and published and is performed exclusively at the Deuk Spine Institute. With the highest published success rate of 95%, the Deuk laser disc repair is proven to be the most successful and least damaging spinal surgery in the world for the treatment of symptomatic damaged discs causing back pain, neck pain, sciatica, and radiculopathy due to herniated, degenerated, or bulging discs.
Good morning. It's March 15th, 2022. I'm Dr. Deuk, and I just came out of the operating room for this patient who you watched me perform a left side L4-5 Deuk laser disc repair. What is the Deuk laser disc repair? Well, it's an endoscopic spine surgery. It's a type of surgery done with a tiny tube, and we see endoscopic surgery being done all over the body now. It's an advanced technology for surgery. In surgery, we used to do everything open. We would make big incisions in the skin. We would use retractors and pull the tissues apart. Of course, all of that was done just so we could see down inside the body to try to get something fixed down in there. But about 60 years ago, surgeons started to use tiny metal tubes that had little lenses and a light source that would illuminate at the end of the tube, and you could actually see inside the body. And you can make a small incision rather than a big incision. And so we call that minimally invasive surgery. So Deuk laser disc repair is a type of minimally invasive endoscopic surgery, and it's done on the spine. So what's happening with the Deuk laser disc repair? Well, you've got a spine, which is essentially bones called vertebrae, and between those bones are discs, which is a giant cushion, and facet joints like this one here. And the problems that people get with their spine usually involve the disc or the facet joint. And basically, in this patient, she has a herniated disc, which is the red thing sticking out there, and it's hitting on the nerve. You all see that there? Okay, good. So the traditional way of fixing this is a microdiscectomy. You come down through the back, you peel the muscle off the spine, which is bad because it damages the muscle, and then you get to this bones and ligaments here. You have to literally drill these away, and that's what I was taught to do, and that's what 99% of spine surgeons do today. They drill these bones and joints away, the facet joint in particular, which causes a destabilization of the spine, which means you're going to have more problems later there where they did their surgery. And they come down to get the herniation, but this way. So what I do with the Deuk laser disc repair is different. We come from the side of the spine. Rather than taking bones and ligaments out, we literally just go right where the herniation is and poke through that, and then zap it away with a laser. And after the herniation's gone, we also clean the tear where the herniation came out. And it's the annular debridement, or cleaning the tear, that's the key to getting rid of back pain. If we do it in the neck, it gets rid of the neck pain that comes from the herniated disc. Now, if you have pain coming from a different source, like the facets and the disc, well, the laser surgery on the disc is only going to fix this pain. It doesn't fix facet pain. So we're going to have to do an additional treatment on the facets, and that's what we're doing next with this next patient. This next patient actually had Deuk laser disc repair. She had both discs, L4-5, L5-S1, treated for disc pain and pinched nerves, and she was really happy with the results. But she developed facet joint pain, which is pain coming from those facet joints. And once again, to show you what the facet joint is, it's these joints back here. Very common problem for people to have. And what we do now is we use the endoscope to go in and kill the nerve to that joint called the medial branch of the dorsal ramus. We find it endoscopically and we rhizotomize it or deaden it using a laser. It's a very successful treatment for facet joint pain. Just to remember, the facet joints are different than the disc. So fixing the disc is a completely different procedure than fixing the facets. Many patients have both disc problems and facet problems. So you need to treat both. Otherwise, you're never going to get rid of all the pain. All right, do we have any questions from our audience? None. Well, I hope you stick around for the next surgery. We'll start it in about 30, 40 minutes, and we're going to be doing rhizotomy, endoscopic, with a laser. All right?